Hey there! Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about neonatal blood gas interpretation. A neonatal blood gas provides critical information about a newborn's acid-base status as well as respiratory and metabolic function. Normal values vary depending on the sample type, umbilical cord blood versus capillary or arterial blood samples, and the newborn's gestational age. Interpreting a neonatal blood gas involves a step-by-step process to determine if the origin of imbalance was respiratory, metabolic, or mixed. The first step is to assess the pH. Normal pH is 7.35 to 7.45. A pH of less than 7.35 indicates acidosis. A pH of more than 7.45 indicates alkalosis. A normal pH can still signify an underlying disorder that is either uncompensated or fully compensated. Step 2 is to evaluate the respiratory component, PCO2. This measures the partial pressure of carbon dioxide in the blood, which is controlled by the lungs. A PCO2 greater than 45 results in a drop in pH. This is known as respiratory acidosis, and some causes include inadequate ventilation due to respiratory sequelae such as RDS, pneumonia, or meconium aspiration. A PCO2 less than 35 results in increase in pH known as respiratory alkalosis. Some causes include rapid breathing or mechanical hyperventilation. The third step is to look at the HCO3, bicarbonate. This is the metabolic component and is regulated by the kidneys. Remember basic chemistry. Normal bicarbonate levels are 22 to 26 milliequivalents per liter. A bicarbonate of less than 22 causes a drop in pH known as metabolic acidosis. Some causes of metabolic acidosis include renal failure, sepsis, and perinatal asphyxia. A bicarbonate of more than 26 results in a rise in pH known as metabolic alkalosis. Causes of metabolic alkalosis include vomiting, nasogastric suction, and intestinal obstruction. The fourth step is to determine the level of compensation, uncompensated. The pH is abnormal, and only one component, respiratory or metabolic, is out of range. Partially compensated. The pH is still abnormal, but both respiratory and metabolic components are outside the normal range in an attempt to correct the imbalance. Fully compensated. The pH is within the normal range, but both components are abnormal, showing that the body has successfully compensated for the underlying issue. The final step is to assess oxygenation PaO2, measures the partial pressure of oxygen in the blood. Normal arterial PaO2 is 50 to 80 millimeters of mercury. This step is only reliable with an arterial blood gas sample. A low value, hypoxemia, indicates an oxygenation problem. Some causes include respiratory disease and congenital heart disease, pneumothorax and aspiration. Key considerations for interpreting neonatal blood gases include 1. Sample type. Umbilical cord blood gives a snapshot of the baby's acid-base status at delivery, while arterial blood from the neonate shows their current respiratory and metabolic state. A capillary blood gas is less invasive but is only reliable for pH and PCO2. It is not accurate for assessing oxygenation. 2. Gestational age. Preterm infants have different normal ranges than full-term infants, particularly for PCO2 reflecting their immature lung function. Always interpret blood gas results alongside the baby's clinical presentation, overall condition, gestational age, and sample type. I will discuss how to normalize a blood gas in future videos. Be sure to like and subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.